Okay, I hope all you guys can see us and hear us. But hi to everyone and thanks for joining us. Welcome to the Northern Westchester Hospital Fall Prevention and Safety Program. My name is Kathy Giaccio and I'm here with my colleague Jeanne Spano. I'm a physical therapist here at Northern Westchester Hospital for about 24 years now, and Jeanne has about 30 years. So between us, that's a lot of physical therapy experience.
A long time.
Long time. So we wanted to share some information with you, and we hope you find it useful, and maybe that will even have a little fun along the way. So there'll be questions throughout where you'll have the opportunity to participate. You'll see as we go along. And also at the end of the program, we'll have time for questions and answers that you can either ask over, right, by asking it out loud and we'll answer, or you can type it in the question, the chat function, and we'll get to those as well. So again, welcome and thanks so much for joining us. And here's Jeanne's gonna start with a little questionnaire.
Hi everyone. So we're gonna start with a little assessing your fall risk, some questions. And you're going to answer the questions to yourself, yes or no. So the first question is, are you on multiple medications? And the next one is, have you had a fall in the past? Do you have multiple health conditions? Do you wear glasses or contacts? Do you see more than 3 doctors? And that could be for any problems that you may have medically. Do you drink alcohol on a regular basis? Do you walk in bare feet or socks in your home, not wearing shoes? Do you have throw rugs around your house? Do you have stairs in your home or to get into your home, and especially that do not have a railing? Do you have lighting for when you get up at night, if you have to go to the bathroom or if you go downstairs? Do you have a grab bar installed in your bathroom? Do you participate in any kind of physical activity on most days of the week? That can be just walking outside or going to a senior center pre-COVID. Have you had your hearing and eyesight checked within the last year? And can you navigate easily through the rooms in your home? Okay, so their scoring for these is you're gonna count the number of yes answers for questions 1 through 9, and then you're gonna count the number of no answers for questions 10 through 14. The higher the score you have is the higher you are to fall. So the higher your fall risk is. So take a minute to just add up your score so that you can know where you fall in that range.
No pun intended. All right, so most likely you had some yeses and nos. But the most important thing is that we learn from these, and we can adjust. Some of these things are in our control. Okay, so we're going to do some audience participation, and we're going to ask some questions and go through the answers. I think you might think some of them are sort of surprising. So the first one is asking about how many adults 65 years and older fall each year in the United States. You click on A for 100,000, B for 500,000, C for 10 million, and D for 36 million.
A lot of falls.
That's a lot of falls. Right, so we'll give you a second to click on some of those answers and then we'll go over it. Okay, I don't see where it's showing the things. Okay, so the answer to that question is, let's see. So 33% of the answers are correct. The correct answer is 36 million, and I clicked on 36 million as well. So the CDC reports that 36 million falls occur each year. That's 1 out of every 4 adults. That's a big number. Each year, about 3 million of those adults are treated in the emergency room for falls. And 1 out of every 5 falls causes an injury such as a head injury or a broken bone. Right? That's pretty amazing. Oh, next question.
Okay, so our next question is each year, at least 300,000 people are hospitalized for hip fractures. In fact, more than 95% of hip fractures are caused by falling. So who do you think falls more, women or men? So we're going to ask you to just pick an answer there. No fighting if you're at home with your spouse over who falls more.
I think it's going to be 50-50.
You want to pick one?
Let's pick one.
Oh, you guys are good. So the answer is women. 75% of you picked that answer. Women are 50% more greater risk for falls. And a lot of that is because of hormone changes with women, and those hormones related with menopause, and that reduces their bone mass. So when they fall, they're more likely to have an injury. They're more likely to trip or stumble while walking, 40% of people. And women tend, interesting fact is that women tend to fall more in the house, but men tend to fall more outside in the garden or doing some yard work, which I found as an interesting fact there. So good job.
Good, you guys are doing good. Okay, next question. Can COVID restrictions that are placed on us have an effect on my balance? What do you think? Let's give a vote. I think this is an easy one too. Okay, survey says yes, 100%. Good job, everybody. So you might think that when you're home, you're safe, right? Not moving around so much, right? Decreases your risk for falling. But studies show that when you limit that activity levels, right, you generally get a little bit weaker, your reactions get a little slower, and that can lead to increased risk for falling. And studies also show that staying active, exercising, and walking decreased your risk for falls. So good job, everybody got that right. That was 100%.
Okay, so we're going to go into your homes now. And the next question is, which of the following can increase my risk of falling? So stairs, rugs, pets, clutter, poor lighting, or all of the above?
What do you guys think?
So this one is kind of obvious too in the answers, but important, especially since we're all spending more time in our homes during COVID. Yes, and you all got 100% all of the above. So that's true. Okay, so stairs are important. So if you have a railing, obviously you want to use your railing. And going up and down stairs, there's a stigma associated with going up and down stairs one step at a time. But especially if you're carrying something that might make you lose your balance, you want to do that. There's no reason that you have to do step over a step and go fast. And you want to use the railing when you're going up and down the stairs, especially, okay? So limit your time carrying things on the stairs, very important, but always use the railing if you can, okay? You want to make sure your walkways are free of clutter and any rug is secure with backing. So any throw rugs that you have throughout the house or any corners of any kind of rug that's down, you want to make sure there's some kind of double-sided tape on those so that you're not tripping and falling over those. You want to add grab bars in your bathroom next to the tub and toilet, and you can use a shower chair if you have one and you feel like your balance is off. They have shower chairs that just go over, especially if you have a tub shower and you don't want to step over into the tub, you can put a shower chair there and then you just kind of slide in. And you always want to have a non-slip rubber mat in your shower or bath if you have any kind of balance issues, especially. You want to make sure you have a night light so that if you get up fast, a lot of times when you get up at night, you have to go to the bathroom and you want to run to get there because you have to go bad. So you want to make sure you have a night light or some kind of small light in your bathroom or your bedroom so that you have a pathway so you can see where you're going. A lot of times you don't give yourself enough time when you go from lying down to sitting up, especially at night. So you want to make sure at least you have light to see where you're going. You want to make sure that you place your commonly used kitchen items in an easy to reach place. Don't put them up on the top shelf where you would have to get a step stool or a step ladder or something to climb up onto, or if you're going to reach really high. You want to limit the amount of time that you're spending on the step stools and the chairs if you have to. And then make sure you don't use one that will move when you're doing that. And if you're concerned about the cost of these things, you remember that you're investing in your independence, okay? Because you want to be able to keep doing these and you want to do it safely. So a lot of these you can get on Amazon now. You don't have to go to a surgical supply store. They're cheaper. You can order them. They're quick. One thing I want to make sure everybody is aware of is pets, okay? So a lot of times from working in the hospital, I see many people that are admitted with hip fractures, and it occurs when they're walking their dog, okay? So you have to, if you have any kind of osteoporosis, or if you are any of those questions that put you at a higher fall risk at the beginning of the presentation, you want to make sure that you, if your dog pulls you when you're walking, that you'll be able to let him go. I know that's hard to say and hard to do, but you know, a lot of times people, when the dog pulls, if they get spooked, that's when people fall and break their hips. So no matter what age you are, even if you're younger or older, dogs are definitely a leading cause of hip fractures. So you just have to be careful with that.
I have another comment on that stuff. So when you're putting the grab rails in your bathroom, if you don't have them already, you know, why wouldn't you do it now rather than after you fall, when it's sort of done emergently and you get some ugly bar that you weren't looking for? They are lovely now, right? They can make your bathroom still stay beautiful, right? And do it while as it's not an emergent situation.
Okay, so now we're gonna watch a video that is 15 ways to reduce falls for seniors, and that goes over some of the things that we just talked about.
Good, some great tips in that video. Okay, we're gonna go to the next question. Which of these body systems are important to my balance? Okay, your choices here are gonna be A, vision, B, my vestibular or inner ear system, my musculoskeletal system, D, my brain, or E, all of the above. Okay, we'll give you guys a minute to choose your answer. Okay, we got 33% said your vestibular or inner system, and 67% said all of the above. So the correct answer is E, all of the above. Okay, so why vision, right? Your vision enables you to scan your environment. Obviously, if there's something on the floor, you see it, you can step over it. So we really recommend that you have regular eye and vision checkups. You get your glasses updated. Your musculoskeletal system, right? That's your muscles and your bones, your nerves and blood vessels. So changes like arthritis, right, can have an effect on your ability to move, or pain has an effect on your ability to move. Even illness and general inactivity can lead to decreased balance. Your brain and nervous system, so things like having a stroke can affect your balance and your strength and your ability to walk. Okay, and then we have that vestibular or inner ear system. Your inner ear or vestibular system is responsible for giving your brain information about where you are in space, right? The next video we're going to show you is a little overview, and this one was put out by the VITA, or the Vestibular Disorders Association. Okay, so let's take a look at that next one. Here it comes.
While we're waiting for the video, so it's important for all these systems to work together. So if you have some weakness and you don't have your eyes checked and you have a cataract, that can affect how your balance is.
We use three main sensors for balancing. We use our sense of information from the floor, from what we call somatosensory information, that tells us when we're shifting our weight and how much we're moving our body over a surface. And we use our vision, so we don't trip on things, and so we can tell where upright is based on what we're looking at. And we use our vestibular system in our inner ear. And the vestibular system is small, interesting, complex organ in the inner ear right next to the hearing organs. So often when you damage your hearing, you could damage your vestibular system. For example, if you had a head injury from a car accident, or you fall and hit your head, you could damage both of those at the same time. Not always, though. Sometimes you'll just damage vestibular and sometimes just hearing. But the vestibular system is actually composed of two main parts. One are these semicircular canals, which have fluid in them, so that when you turn your head or you pitch your head forward and backward like this, they detect movement of the head and angular velocity. And then there's another part of the vestibular system, which is called the otolith system, which have little hair cells that are sensitive to tipping your head with respect to gravity. So now when you tip your head to the left, your brain knows that you're leaning to the left or forward or sideways. So some people who have vestibular problems have problems primarily because the canals are damaged, and so they're going to have problems when they rotate their head or tip their head back. Whereas people who have more otolith problems, they might not have that problem at all. They just find themselves tipping over. They not know where gravity is. So depending on what part of the vestibular system is affected by the particular problem that you have could really affect the symptoms that you have. And some people who have no vestibular function don't ever get dizzy even though they have terrible balance, but they may not have any dizziness associated with it. So it's a pretty complicated organ, and it can cause many different kinds of problems but most of them affect balance control.
Okay, so that sounded really complicated, didn't it? Well, the good news is that you don't have to worry about all those details because physical therapists are trained to know about that, and we understand how it works, and we're able to give you very specific exercises to eliminate or decrease any of those symptoms, which also improve your balance. Right, so next question.
Okay, so the next question is, what is postural hypotension? And the A is when my blood pressure goes up because I ate too much salt. B, when my blood pressure goes down after sitting or lying down. C, when my blood pressure goes down because I don't drink enough water. Or D, when my blood pressure goes up and then down. Okay, so you guys are going to pick one answer, you think.
That's a hard one.
It is a hard one. But so postural hypotension is important when we were talking before about lying down and sitting up, okay? So just keep that in mind. B, when my blood pressure goes down after sitting or lying down. Yep, that's the right answer. So it's important to know that your blood pressure is affected by many different things, okay? It can be you can have high blood pressure, you can have low blood pressure, and both of those can be affected when you go from lying down to sitting up, okay? Diabetes, heart failure, any kind of neurological disease, such as Parkinson's or dementia can affect your blood pressure, and that can affect your balance. Medications like diuretics or antidepressants or blood pressure meds, those can affect lying down to sitting up and the fluctuations in your pressure. So you should know the side effects of your medications. So you should read those over carefully. Dehydration is an important one, okay? So especially when we're home and we're not exercising as much, people usually associate drinking more water when they're more active. So you should be drinking 6 to 8 glasses of non-caffeinated or non-alcoholic beverages a day. So mostly, important to drink a lot of water, even if you're home and not as active as you would be, especially with the winter coming up. Vitamin B12 deficiency, anemia, alcoholism, any of those things, prolonged bed rest. So if you had pain and a flare-up of your arthritis, or if you hurt your back and you're lying down, prolonged bed rest can cause fluctuations in your blood pressure. So going down from lying down to sitting up can change that. So especially at night, like I said before, when you're lying down and you get up and you have to go to the bathroom, you want to make sure you try and sit for a minute if you can, just so that you can make sure you have no dizziness. These are the symptoms here. No dizziness, no lightheadedness. Sometimes you feel like you're about to pass out, faint, or the room gets spinny. You feel like you're going to fall. Headaches, blurry vision, tunnel vision. If you feel pressure across the back of your shoulders or neck, or if you start to feel nauseous or hot and clammy, those are symptoms of postural hypotension. So you want to take things slow, sit for a minute, and before you stand up, because that's when you might lose your balance, or worst case scenario, you would pass out. But we hope that would never happen because you're going to stay hydrated, and this is not going to happen to you.
Okay, next question. We have a few more. Next question says, if you are feeling unsteady, that staying seated all the time is going to make me safer. What do you guys think? False. It is definitely false. 100% right. You guys are good. That was kind of an easy one, wasn't it? Okay. So we already mentioned about studies that show that if you're sedentary all the time, really just go from the sofa to the bathroom, to the bed, to the kitchen, it really will increase your chance in falling, because in general, your strength and your coordination, they just deteriorate. And studies also show that increasing your activity levels decrease your risk for falling.
And also, so, you know, bones they're made to bear weight on them. So if you're not up and moving around and you're not increasing those weight bearing activities, and with your sedentary lifestyle, then that inactivity can lead to, you know, loss of bone density. And that if you have osteopenia or osteoporosis, especially for women, that can increase your risk of falls and your increased risk for fractures. Okay, so the next question. What do I do if I fall? Okay, so that's an important one. So the answers coming up are panic, get up right away, scream for help, or D, none of the above. This is pretty obvious also.
You scream, right? Okay, let's see what they got.
So those answers weren't made, you do scream for help, but in a calm way. These answers are the things that I wanted to show you not to do, okay? So it's very important that if you do fall, that you stay calm. That's the most important thing. You want to take a few breaths. You want to remain on the floor. You don't want to try and get up right away. You have to get over the shock of falling, because sometimes that adrenaline will make you just want to get up. And if you have an injury, you can make that worse by getting up right away. So just stay calm, take a few deep breaths. You want to assess your injuries, okay? So you want to see what did I hurt? Where did I land, especially? So if you landed on your hip or you landed with an outstretched hand, those are the areas. Hopefully you didn't land on your head, but you want to assess the areas that you hit when you fell, okay? And those are the places where you're most likely to have an injury. So just see what you're feeling there. If somebody else is home, then you could scream for help, okay, but in the calm way so that they don't fall coming to get you. You want to make sure, just make a lot of noise so that somebody knows that you have fallen down and that you need help. If nobody's there, then you want to try and crawl. If your injuries are not too severe, you want to try and crawl to your nearest chair or couch that is located near a phone. Very, very good idea to have your cell phone, or if you have a portable phone, with you, especially if you answered those questions and you were on the higher end of being a fall risk. You always want to have a phone with you so that in case you do fall, you can reach somebody quickly to come help you, okay? So we're gonna watch two videos. One is gonna show you how to get up from a fall, and the other one is going to show you how to help somebody up from a fall in case your spouse or friend falls.
How to get up safely if you have a fall. It's best to plan what you would do if you had a fall. Firstly, don't panic. Check you're not hurt. Are you in pain? Can you move your arms and legs? Don't move if you feel pain. Try to summon help instead. If you are unhurt, try to get yourself up. Move onto your hands and knees and crawl to somewhere where you can pull yourself up, like a sturdy chair or bed. Put your hands on the chair or bed and bring one leg up, bending your knee and placing your foot flat on the floor. Lean forwards, pushing with your hands, and bring your other foot up so that it is also flat on the floor. Turn and sit on the furniture slowly. Make sure that you rest for a while before you try to stand up. It's a good idea to practice this so you know what to do if you have a fall. And remember, always tell your GP about your fall.
It's important to check the person who fell for injuries and call 911 if needed. Only attempt to help the person if you feel that both of you are able to safely work together. Otherwise, call for assistance. To help someone up from the floor, they will need to get into a crawling position. If the person is on their back, help them to bend their knees up, reach across their body in the direction they want to go, and roll over onto their side. Help by gently pushing at the hips and shoulder areas. Now help them to bring the top leg out in front of the bottom leg. Place your hand under the shoulder touching the floor and lift the person so they can pull out the arm and rest on their hand. Now, move your hands to the hips and help lift them up and over, allowing the patient to get onto their hands and knees. Guide the person in need to crawl close to a sturdy, secure piece of furniture and place their hands on it. Help them to pull their knee forward and place their foot directly under the knee. This should be done with the leg they feel is the strongest. Come around to the other side of the person and help lift them to stand by hooking one arm under their arm and placing your other hand on their back. Remind the person to lean forward while pushing up with the bent leg and both arms. Have the person stand for a moment to make sure they are steady and not dizzy. Slowly turn and sit.
So it's important to remember to only help somebody off the floor if you physically can do so, okay? If you have any kind of injuries, arthritis conditions, back pain, neck pain, or if somebody is larger, please do not attempt to do that. You should dial 911 and call your local police department or get a neighbor to come over and help you. But if you're healthy and the person who has fallen has no injuries and they're healthy and you feel that you can do that safely, then that's what we're showing you how to do. Okay, so our next question.
Next question. It's coming up. Okay, question number 9. If I am at risk for a fall, what should I do? A, talk to my doctor. B, get a physical therapy evaluation. I think we'll be biased on that one. C, get a balance center evaluation. D, become more physically active. And E, all of the above. What do you guys think? I think we made your questions a little easy, huh?
So none of these answers are the wrong answer, honestly. So if you had picked any one of them, it would have been correct.
Yeah, for sure. Good, but it's, you know, it's really important to keep your doctor in the loop, right? Sometimes we'll get patients who come and they say, well, they'll be sitting there with their spouse telling me about, you know, their recent fall. And then I ask the question, so, you know, how many times have you fallen in the past 6 weeks or 6 months or the past year? And they say, oh, about 6 times. And their spouse looks at them and say, what are you talking about? They're like, oh, I just got up myself and I was okay. You know what? You got to tell everybody because we can prevent the next fall from happening. So you always want to discuss with your doctor, even if there's no injury, you want to tell them that you fell. Write it down and the details about it so we can figure out, you know, what the cause was. Your doctor can assess if there are any medical issues, the ones we spoke about in the previous questions, that they need to address, or they can refer you to us, to physical therapy, right? And there's an awful lot that we can do for you.
So becoming more physically active, workouts that focus on improving your balance, improving your coordination, improving your mobility, improving your flexibility will help to reduce your risk of falls. The studies show like a Tai Chi class, people have a 19% lower risk for falling, any kind of low impact walking. And, you know, the physical therapist, if you're at risk for falls or if you have any kind of diagnosis that would put you at risk for like osteoporosis, or if you fell to get an injury, can set up a home program for you for something like that. The balance center evaluation is what Kathy spoke about before. The vestibular issues, if you have dizziness or ringing in your ears and you make your doctor aware of that, the balance center could evaluate that, and then they would make the proper referral to physical therapy for exercises, or back to the medical doctor to see what they would have to work you up for. Okay, so the next question goes into physical therapy. What can physical therapy do for me? Okay, so the responses are: assess my balance, assess my gait, assess my strength, prescribe a safe and effective home exercise program to address all of the above. And the answer to choose from is E, all of the above. You got it. So here at Chappaqua Crossing, we have many therapists who are not only proficient in everything, they can treat most diagnoses, but we have some people who specialize in balance, some people who specialize in dizziness, some people who specialize in musculoskeletal problems. Some of us have treated more geriatric people, have specializations in Parkinson's disease or in post-stroke, or all kinds of diagnoses like that, which would help you to develop an exercise program, or to develop or to make sure that you increase your strength, increase your balance, improve those kinds of things. We set goals for you, and we'll develop something specific to you, your needs. Anything to add?
Yeah, we do it all, pretty much, is what Jeannie's trying to say. We do everything. So the phone number is right there. You do need a prescription from your doctor, especially if you're having a balance issue. Just don't wait for something bad to happen, right? Even if you come for 2 or 3 sessions and we give you a home program, right? Or at least, use some of the information that you got today and, get out there and start walking a little more. Do your own exercises. But we're really here to help you. So please give us a call.
And do you guys have any questions for us?
Oh, so let's look here. Oh, there's a great question.
Yes.
So what are the COVID safety protocols that are in place at Chappaqua Crossing in physical therapy? Okay, so everyone, just like some of the other places that you've been, even your doctor's office, you're required to answer a questionnaire about your exposure, and then also about your symptoms, whether you've traveled anywhere that's risky, and if any of those answers are yes, then your appointment is postponed.
That's every appointment that you come to. You're asked the questions.
Every single one. We have limited our waiting area. We try to have everyone wait in their car until it's time for your actual appointment. Then you come in, we have everything sort of streamlined. Everyone has to wear a mask. The therapist, the patients are wearing masks. If you come in with a cloth face mask, we give you a fresh one every time you come in.
The therapists are wearing medical masks, and then we also have to wear some kind of safety shield.
Yeah.
So either goggles or a shield mask we have over our face at all times. We have the gym spaced out, so everybody, all of our treatment mats are 6 feet apart. We've limited our exercise equipment, so we only have 2 essential, most used things here that we use a lot of times, and those are separated from 12 feet because of the droplets that come out when you exercise. Even though you have a mask on, we want to be extra safe. We have 2 gyms, and we have 6 private treatment rooms. So if you're more comfortable in a private treatment room, we'll bring you in there. But the gym is safe that we have everybody spread out.
And every piece of equipment that is touched, and usually, therapists have gloves on. We offer gloves to the patients. But every time you touch a piece of equipment, it is cleaned after every single use. So we've really did a good job, right, of making it safe for everyone to come.
And we do make you, not make you, but we suggest that you wash your hands after you leave, and we have hand sanitizer spread all over the building. So on your way in, on your way out, anytime you touch a doorknob, there's always a hand sanitizer right near there for you.
Yeah, it's really kind of COVID-friendly place.
We do limit the amount of guests that are allowed back. So if you did come with your spouse, or unless you had a caregiver that had to be there with you for safety purposes or to show them an exercise program, we don't, or any children that come back, they require a parent. Other than that, we don't let anybody else come to the back of the gym where people are.
Okay, well, if that's it for questions, we enjoyed doing this presentation for you, and we hope to be bringing some more from our physical therapy colleagues.
And we thank Amy from the Center for Healthy Living for helping us.
And if you guys have anything that you want to hear about, if you let Amy know or give us a call and let us know, we would certainly put it in the pool to maybe present to you in the future.
And if you have any other questions that about physical therapy, or if you want to know if you should come or if you think you should come, you can call us and ask for either Kathy or myself, Jeannie, so that we can, and we'll talk you through it. Thanks everybody for attending. We hope you have a great day.
Bye.